Hello, thanks for joining us. This is Dr. Mark Mugavin from the Kumar Eye Institute. Today we'd like to give you a little inside look into intense pulse light therapy for chronic dry eye. We perform this treatment for patients who have grown tired of putting in drops with minimal relief of their symptoms. It's been in dermatology for around 25 years, but recently moved into ophthalmology in the last 5. In fact, in May of this past year, it was approved by the FDA as a treatment for treating the signs and symptoms of chronic dry eye. The first step involves identifying the right candidates for intense pulse light therapy. We only want to offer it to those patients we feel have a high likelihood of achieving relief. At Kumar Eye, we have 2 cutting-edge diagnostic tools that allow us to properly identify those patients. One involves using video technology to characterize the stability of your tear film. Another test actually assesses you for evaporative loss and looks at the vitality of your tear glands. We can use infrared cameras to study whether or not there's atrophy. In this picture, we see a nice picture of healthy tear glands, and then we can compare that to abnormal tear glands in someone who would likely benefit from the treatment. The most impressive aspect of intense pulse light therapy is that it treats the root cause of dry eye rather than putting a band-aid on the problem with drops. It does this by 2 mechanisms. It uses a special wavelength of energy and a carefully defined pattern distributed to the face to eradicate abnormal blood vessels on your eyelids. And these abnormal blood vessels continuously leak inflammatory compounds that cause a cycle of inflammation and cause the symptoms that you're experiencing. Interestingly, this is one of the reasons why IPL was studied in ophthalmology, because patients with rosacea in dermatology were showing relief from their chronic dry eye symptoms. Thus, the correlation was made, okay, these abnormal blood vessels can cause problems for your eyes as well. The other reason why it works is it revitalizes the mitochondria of your tear glands to ramp up production of your natural tears. The treatments require a commitment. A typical regimen involves 4 sessions, which take approximately 20 minutes apiece, spaced apart by 3-week intervals. There are no restrictions on activity after the treatment, and the patient may feel like they have a light sunburn for a few days, and they're encouraged to apply sunscreen actively for 5 days following the treatment.
Hello everyone, this is Dr. Mark Mugavin from the Kumar Eye Institute. We decided to make a little video walking you through what intense pulse light treatment for chronic dry eye looks like. We have one of our patients here, Joan. This will be her 4th treatment, and we're just going to walk you through the basic steps of what it looks like to get IPL. What we do is apply this intense UV energy to the surface of the skin to reduce inflammation. And we also want to prevent any damage from the intense light. So we put in some numbing drops, and then we put in some corneal protection shields to help prevent any side effects. So you'll see that here in just a minute. We've got the shields in. Probably the most uncomfortable part, it feels like a contact lens basically, is to put aloe vera all over the face to protect it from absorbing a little bit too much energy. So we'll do that. So we're going to introduce you to the Optima IPL laser. This is our fancy equipment that makes the magic happen. So if you come over here and look at the screen, there's all kinds of different settings for this, but what we've found works the best for most patients who have chronic dry eye and also want to get rid of some of those age spots on their face is to use the facial telangiectasia setting, and then also to do the meibomian gland dysfunction setting. And so we'll walk through doing those settings just a little bit. And so you don't need to know all of the details, but basically we've punched in some energy levels that fit a questionnaire that Joan filled out initially that fits her skin type and her heritage. So we'll go through the different wavelength settings and different energy settings, and we adjust it session by session based on how the patient responds. Okay. So we're about to fire away here on the laser. Joan's all gelled up. We've punched in her settings, and we're going to start her intense pulse light treatment. Joan, anything to say about the treatment? Does it hurt at all, or?
It doesn't really hurt. It's just kind of shocking.
A little startling?
Yeah.
Yeah. Okay, sounds good. All right, we're going to go ahead and fire away. And so what we're doing is applying an even treatment with this light guide, and we're marching our way all the way across her face. People think dry eye is really only your eyelids, but that's not true. The skin around your face can have a dramatic impact on how comfortable your eyes feel. So this energy of application rejuvenates the skin and gets rid of abnormal blood vessels that can grow on the surface of your skin and release inflammatory compounds. So we treat the entire face when we do intense pulse light treatment for chronic dry eye. So we've treated for those telangiectasias, those funny blood vessels on the surface of the face and the eyelids that can cause inflammation. Now we're going to switch to a different setting, a setting that has been studied to rejuvenate the tear glands. So we'll adapt our settings here on the IPL laser and then fire away a different module. So here we go. We're going to go ahead and fire away with the rejuvenation of the tear glands.
We hope you've enjoyed this brief video on intense pulse light therapy. If you're interested in learning more, visit our website, www.kumareyeinstitute.com, or call 502-368-3937 to schedule a inpatient consultation at our Poplar Level Road location. Thanks and have a great day.